watching 13 News. Thank you so much for joining us at noon. I'm Alyssa Raymond. Just a few hours ago, we received an update on the new coronavirus cases all across Indiana. The State Department of Health says there are 168 new positive cases of COVID-19 in the state. 645 people have already tested positive for the virus. 3 more people have died, bringing the total number of deaths here in Indiana to 17. We're expecting to hear more from Governor Holcomb later on this afternoon. We're thinking right around 2:30. He'll be with the State Department of Health and other state leaders to provide any updates on COVID-19's impact here. Remember, you can watch that right at 2:30 here on Channel 13. What's now being called the CARES Act is a step closer to becoming law. It's a $2 trillion economic stimulus bill, and it's designed to help people and businesses hurting from the coronavirus outbreak. NBC's Chris Pallone talks about the work done by the Senate and what comes next.
The Federal Reserve doesn't exactly print.
This morning, in an exclusive interview, Federal Reserve Chair Jerome Powell reacted to the overnight Senate vote and assured Americans that this is not a typical downturn because American businesses are being asked to close.
At a certain point, we will get the spread of the virus under control, and at that time, confidence will return, businesses will open again, people will come back to work.
After days of partisan disagreements and finger-pointing, the Senate finally reached common ground.
On this vote, the yeas are 96. The nays are 0.
Passing a $2 trillion economic relief bill with hopes it will provide help to people and businesses blindsided by the coronavirus outbreak.
Not a single senator voted against this $2 trillion rescue bill.
I'm damn proud of the work we did over the past few days.
The Senate bill would send direct payments to Americans whose earnings fall under certain limits. $1,200 checks for individuals, $2,400 for families, plus an extra $500 per child. It also includes loans for corporations and small businesses with incentives to keep workers on the payroll, relief for the nation's hospitals, and expanded unemployment benefits, which would mean 4 months of full paychecks for laid-off workers. The bill now moves to the House, where a vote is expected Friday.
Think of the size of the bill that you're asking members to vote on. They need to have their constituents have the ability to have their voice be heard.
The economic aid bill passed just hours before the release of the nation's latest unemployment numbers, a dire snapshot of just how quickly the pandemic has devastated the nation's businesses and workers. Chris Pallone, NBC News, New York.
And new at noon, there's a record high number of people who've applied for unemployment benefits, around 3.3 million. And all of this comes as layoffs take over here in the United States. The surge in weekly applications for benefits far exceeded the previous record set back in 1982. Revenue has collapsed at places like restaurants, hotels, movie theaters, and gyms. Car sales are also falling, with some car makers now closing factories. We've talked a lot about the impact the coronavirus outbreak is having on hospitals, but what about patients already suffering from serious illnesses? Emma Doubt was rushed to the ER for what doctors thought was COVID-19, but later found blood clots in her legs. But now doctors and nurses have to make room in the hospitals for coronavirus patients. The Doubts say it's unclear at this time what Emma's diagnosis is, but they say they're just grateful that she's alive. As this pandemic continues, we do want to make sure you have all of the facts. And one of the big questions right now is, where are those coronavirus tests? Why are politicians, athletes, and entertainers getting those test results so quickly when there are vulnerable patients who are still waiting for weeks? 13 Investigates reporter Sandra Chapman has been looking into this to find out where the rapid tests developed here in Indiana are going.
Hoosiers across the state can't understand why patients most at risk, like Bonnie Bowser, can't get rapid coronavirus test results. Bonnie's daughter Lisa told WTHR, "My mom was in the hospital for 6 days waiting on results. They released her without getting any test results, told us to just act like she is positive." Bonnie, who is 72 years old, has underlying health conditions.
And those are the tests that we need to really be able to turn around quickly. Those are the people that are admitted to the hospital, that are long-term care facility workers.
The Indiana Health Commissioner says ramping up local labs should help. Indianapolis-based Roche has provided 400,000 rapid result test kits for highly automated processing. But where are the kits going? 13 Investigates reached out to Quest Diagnostics, one of the private labs working with the state of Indiana. Here's what we found. Quest is processing tests in 12 labs hundreds of miles away from Indiana. Take a look. Quest is using the Roche test and one of its own COVID-19 tests at sites in California, Virginia, and Massachusetts, while 9 other sites from Texas to Kansas, Florida, New Jersey, and Pennsylvania, Illinois, Arizona, and circling back to California, all use the Roche system. It means results may not be provided for a week or longer during the crisis. The state health commissioner says that pipeline should be for non-emergent cases only.
Other individuals that are sick but may not need to be admitted to the hospital, when they're sick, they need to go home and isolate anyway. So those are the tests that I think can afford to have a longer turnaround time.
Quest itself is taking steps to address cases like Bonnie Bowers, who sat in a hospital for 6 days and sent home without a result.
Bottom line, Quest says the increased demand and the need for quick turnaround times is a challenge. So it is directing hospital networks across the country on how to label these specimens as high priority, starting with inpatients and then healthcare workers showing signs of coronavirus.
That's our Sandra Chapman there, and you can see all of our investigative reports right now at WTHR.com/13investigates. Your time right now is just about 12:02.